Thank you for joining us today for our first panel in our series titled ABA Beyond ASD. So I know people will be trickling in as time passes, but in the interest of time, we'll get started. Before we do get started, though, I do want to let everyone know that we will be recording this session. We'll hit the record button in a moment here. So if you would not like to appear on camera, be sure to turn off your cameras. The recording will be posted on YouTube, so it's accessible to anyone who isn't able to attend today. So I will go ahead and hit the record button, or it's already recording. It's Friday. I don't know. I'm all over the place. Okay.
I started it.
Thank you so much. So I will share my screen. Let me move things. Okay. So as I mentioned before, we have a series called ABA Beyond ASD, and our first panel focuses on clinical behavior analysis. We were very fortunate enough to be given a grant by the Society for the Experimental Analysis of Behavior, or SEAB, to fund essentially this project and this series of panels. So as a mini agenda, we'll briefly go over what the purpose of this series is, followed by a pretest. We'll explain a little bit more about what that entails, why we are including it. And then we'll have our panelists introduce themselves, and we'll get into the actual panel. Afterwards, we'll have time for hopefully a small Q&A with you all. And then we'll do a pretest, and then we have a raffle for students who are interested in pursuing graduate school. Our raffle, whoever wins the raffle will have one of their graduate application fees waived. And that's part of the purpose of this series. So to kind of get into things, so Dr. Lesley Shawler, and Dr. Williams Awodeha and I have come together to create this project, this series, the ABA Beyond ASD series. And really, the purpose of it is to expose undergraduate students and graduate students to the different applications of behavior analysis, right, beyond autism spectrum disorder and related developmental disabilities. And to introduce them to respective leaders in different subspecialties. So one of our subspecialties that we're highlighting is clinical behavior analysis. That's part of the aim and the purpose of this project. And we also hope to increase the maybe diversity of future practitioners in the field. And one way of doing that is by having this raffle of students who are interested in pursuing graduate school to help pay for one of the graduate application fees. So that's part of the purpose of the raffle. And all three of us are faculty at Southern Illinois University in the Behavior Analysis and Therapy program. All right, I'll pass it on to, I think, Lesley.
So if you guys are able to scan in to start working on the pretest, we also just put the link in the chat if you are not able to scan in. We want to just get a little bit of background information, but also as to why you're interested in this specific panel, but also just as a way to measure knowledge from, pre of the panel. And then at the end, we will ask you to also complete the post test, just as a way for us to gauge efficacy of our discussions and make sure that, we're doing what we need to be doing to provide the information that we're hoping to get to you guys, but also just to collect some information about the panel itself. So if you all don't mind just scanning in or going to the link provided, that will give us some preliminary data just to kind of get us started. All right, and if you have any, if you guys are having any technical difficulties at any point in the panel, please just feel free to comment in the chat. Dr. Williams Awodeha will be kind of monitoring and can provide assistance if needed. So please just let us know if you have any technical difficulties with any of the links or the QR codes or audio or anything like that. All right, do we want to go ahead and pass it on to the next slide? And then if anyone comes into the room after today, then I will, we can put the link back into the chat for those people. Oh yeah, sorry. So if you are a student, like Dr. Baires was just commenting, really the purpose and the mission of our panel series is to help any interested students who are looking into behavior analysis and maybe want to pursue areas outside of autism or developmental disabilities, if that's something they're interested in. Hopefully, after attending this panel or subsequent panels, it might pique your interest. And you know, we do want to be able to provide resources, which we'll talk about at the end, where if you guys are interested in specific programs, provide you with some ideas or backgrounds so that those are programs that potentially you might be interested in applying to in the future. So if you guys could, if you are interested in being entered into the raffle, just go ahead and scan here. Again, the link for this is in the chat. We do ask that that only if you are a student who is thinking about or planning to apply to graduate school in the future, apply, just so that, you know, if you do get selected, of course, we want it to be somebody that we can potentially help if that is a barrier for applications. And we can put this up again after or during the Q&A, just if people are still kind of trickling in. All right, I'm gonna go ahead and put the stuff in the chat because a few people just entered the room.
Okay. Are we okay to move on, or should we give a little bit more time and move on? Okay. All right, well, we'll get right into our panel. I know you all are super excited, as am I and the rest of us. So we have three amazing panelists joining us today. Dr. Luisa Cañon, Carris, and Dr. Gregory Young. So actually one of our first questions is for them to introduce themselves. So we will jump right into the panel discussion and start with that question. So I will pass it over to our amazing panelists.
I guess I can go first. So hi, I'm Dr. Gregory Young. I'm a behavioral analyst and psychologist. I work at Francis and Children's, which is in Boston, Massachusetts, and I am the director of training and very newly the assistant director of behavioral health services. And so my area of interest is where medical complexities meets behavioral difficulties. So really what I do is I help individuals learn to adjust and cope to complex medical care. And so that could be tolerating admissions to a inpatient rehab program, or it could be learning to tolerate a CPAP mask while they're sleeping, or a blood draw for a procedure. And so broadly speaking, that's the type of work that I do. And was there anything else you were hoping for me to cover in this kind of initial introduction?
No, I think that's a great introduction. Thank you.
I don't mind going next. My name is Allie, and I hail from Illinois, although originally by way of Detroit. So for Midwest is what I am most familiar with. And I share that because I have worked in the state of Illinois in the capacity as a BCBA as well as an LCPC, which is a master's level clinician, why get one master's when you can get two? I don't recommend doing them at the same time, but I did. You can. So I'm very familiar with the state of Illinois policy and procedures around behavior analysis, and specifically clinical behavior analysis, and how to find creative ways to practice ABA in this way and ensure that you can get paid for the work that you do. Because the work I do as a licensed counselor is behavior analytic in nature, I can't necessarily utilize traditional ABA funding channels, if you will. So I founded our organization Behavioral Learning just a few years ago because of that, because I wanted to bridge that gap between counseling and behavior analysis and find ways to meet people's needs and also help pay for the work that we were already doing. And so that's what brought me here today in connection with this panel.
I always love to go last. Well, my name is Luisa Cañon. I am originally from Bogota, Colombia. And so I am a behavior analyst and also a licensed clinical psychologist in the state of California. I'm not living there anymore. I moved to Florida. So anyway, so that's another story. I can tell you that I do have a private practice, and so I do work with young adults with anxiety, specifically high functioning anxiety. So individuals who are commonly playing the game of like wanting to fit a square peg into a round hole. I also work with relational trauma and, well, help individuals create like flexible and nurturing relationship to self, others in different contexts. Also do family work and couples work. I also consult with behavior analysts, and I'm also a professor at the University of Nevada, Reno. So I have been interested for many, many years in helping to bridge, the gap between behavior analysis and psychology.
Great, thank you all for those great introductions. So that leads us to our next question. Since the topic is clinical behavior analysis, how would the three of you define what clinical behavior analysis, or CBA, is?
I like to go with parsimony. So, I mean, I think it's a lot simpler than people think. It's just the application of our behavior analytic principles to areas of psychology that are traditionally thought of as, mental health areas. That could mean a variety of things. So that's why our introductions were so different and unique, because we can apply it in so many ways.
Well, clinical behavior analysis to me is about not only the alleviation of human suffering, but it's about bringing joy and flexibility, prosociality, resilience, social justice to the lives of people that we are privileged to work with.
I feel both of you did a beautiful job discussing. I don't have anything additional to add. I think those were great answers.
Great, thank you very much. Those are great definitions or descriptions of what you all, define clinical behavior analysis as. All right, so the next question, and maybe, I don't know, I can start, I guess, calling on panelists to answer if that helps. So the question is, what training and preparation is needed for clinical behavior analysis, or maybe what kind of training and preparation did you receive to help working in this, I guess, area of behavior analysis? Gregory, do you want to go ahead and answer that one first?
Yeah, I think it's interesting that all three panelists are not just behavioral analysts. I don't mean just in a bad way, but I think that one of the things that has happened in the field is that it's really hard for straight behavior analysts to work outside of the autism field because of funding resources, right? And there is a reality of we need to find a way to get paid for the work that we do. And so, for myself, it's really hard to break into behavioral pediatrics, not as a psychologist or a mental health clinician because of funding streams. So for myself, I went into a Ph.D. program in combined school and counseling psychology. I pursued practicum experiences in hospital settings doing pediatric work. And really, prior to going to grad school, had some experience in doing in-home ABA and early intervention, and really kind of brought the work that my background into the work I was doing. And as I continued through my training through internship and postdoc, which I pursued opportunities to do that in hospital settings, I continued to kind of pursue my BCBA at the same time. And so it's really a combination of psychology training and internships and postdocs where I was able to get some really incredible training and experiences and figure out a way to fit it all together, because not all pediatric psychologists are coming from it from a behavior analytics standpoint. Many of them are coming from it from a more neuropsych standpoint or other perspectives. I think.
Great, thank you so much, Dr. Young. Ali, do you want to share your, I guess, experience, training, preparation in relation to clinical behavior analysis?
Sure. So my path to behavior analysis, interestingly, was through theater. So my degree's in psychology and theater and French, a whole bunch of liberal arts things that I graduated not knowing what I was going to do. And I happened to be hired on as an actor in a large mental health organization to work with inpatient folks and put together theatrical and creative performances. And I was like, I love this. I want to do this all the time. And my leanings were in behavioral psychology, and I did a lot of research and looked around and happened to find a behavior analytic program that would also then let me do a master's in counseling as well, so that I knew I could get the behavior analytic training I wanted and be able to still work with the mental health population that I wanted. I wasn't sure if I wanted to go on for a PhD, and now that I have two tiny humans who also call me mom, my husband and partner is like, oh no, you're done. So instead I got two masters, which you can do. In Illinois, the unique thing is, and in most states too, and you can always back channel me to talk about it if you're exploring what to do next in terms of grad school. If you have an graduate degree that has enough credits and it's in ABA, you can take a few extra classes and still sit for your counseling exam. So there's some really creative ways to go about acquiring a dual credential. And so you don't have to do two masters, two full degrees. So in terms of my training, I just got, much like Gregory shared, it's so important, that hands-on piece, and to be able to have through my internship and practicum experiences, I had a variety of different ones, both through the counseling lens as well through the behavior analytic lens. And I happened to get lucky enough to study under DJ Moran when he was living in Illinois, and so got some of my early training in ACT there, as acceptance and commitment therapy and functional contextualism. And just was like excited and wanted more, and so just continued to pursue those opportunities and to create what we're doing today.
Great, thank you so much for sharing your journey. Dr. Cañon?
Sure. So I really just want to highlight what Ali shared about really checking like where you live, like for alternatives. You might not have to do another master's or a Ph.D. or a Psy.D. So that's super important. But also, I think really defining what is exactly what you want to do, what population do you want to work with, what setting, what issues. So that's one thing. On the other hand, I think that, and I have been, and I am much more right now concerned about the repertoires that I think are needed, but are also missing in behavior analysis. And I think that a way, I think that one way to even, or maybe even at the same time of considering, pursuing another, like a licensure or something that allows them to do CPA work, right? It is, I guess, self-reflecting on the set of skills that I guess we know that are not necessarily trained in graduate programs. And I see often people talking about context and yet not really considering context more broadly. I hear people talking about relationships, and yet I don't see that there is, or that they consider a bi-directionality of the interaction and the relationship. Humility is another thing. A lot of people talk about humility, and yet I see a lot of BCBAs going into the field thinking that they can probably, grab the world, with one hand, because they know the principles and they know how to, instigate and like behavior change. So not only that, but also I think the social validity piece that we all so much talk about. I also see that as people trying to intervene not beyond symptom reduction or getting rid of problems. And also intervening on things that might not really matter for the client. So I am much more concerned about how do we become proficient in those set of skills and those assumptions. How do we get our philosophy together in order to do a really good work in clinical behavior analysis?
Great, thank you so much for everyone's response. Next question, I guess if we could start with Ali, I'll switch the order amongst our three panelists. So the question reads, what advice do you have for students who want to pursue clinical behavior analysis?
I think to echo a little bit off of what Luisa was saying is I would say engage first in that self-reflection and take a look at what it is that you want to do and how do you want to apply this. I am a huge proponent of educating ourselves around our own self-care and needs and what that looks like, and that includes the lifestyle that you want to have as well. So if you can, I would say start with your own look and then get a mentor. Find somebody, reach out to someone who is practicing this, to your past professors or potentially future professors, and see if you can have conversations around what it is that they do and learn from them. So I think you're doing the right and first step too by attending this panel, for example.
Great, Dr. Cañon?
So I think that a piece of advice for people wanting to shift into CBA is to really plan ahead and do your homework, but also really prepare for kind of playing the long game. I see a lot of BCBAs. I feel that I am like killjoy in this panel instead of highlighting the great stuff. I'm going the opposite direction, but I really want to keep it real here. So I see many people are getting like, burnout. The burnout rates in behavior analysis are huge, and people are not. I don't think they are working with their hearts anymore. I mean, not everybody I'm saying, but few BCBAs here and there. And they desperately want to move into CBA, and they are not, preparing really for that. And I think that it's important to know that you spend 60% of your week at work, and moving into something else without preparation, without supervision, without mentorship is gonna, you're gonna set yourself for burnout again. So I think that's kind of the advice, like thinking long term. I personally, I did clinical psychology in Bogota, Colombia. And then when I moved to the States, I did my master's in behavior analysis. And then I went to do my Psy.D in clinical psychology. So again, it took me so many years. And I am not saying that you have to do the same. There are shorter ways, but definitely, there are other ways, but I wouldn't encourage just jumping from one thing to another, thinking it's going to be easy. And especially when you don't have, the framework that supports, the work.
Great, thank you. And Dr. Young?
Yeah, and I feel like there's some themes developing in kind of the things that we're talking about. And Luisa, I really appreciate how you responded to the previous question. It really resonated for me. I think looking back at my earlier stages of training, I was maybe overly rigid and maybe dogmatic in my approaches to behavioral analysis that prevented me from becoming as good of a clinician as I could have back then. And I think that rigidity is something that we often treat in our patients, right? We try to help them become more cognitively flexible individuals. But I also think that many of the clinicians in the field struggle to become flexible in their thinking and conceptual framework around the work that we do. And so I think exactly to some of the pieces that have been talked about, like we really have to pay attention to the relationships that we have with our patients, their families, and other providers. And we need to really reflect on a lot of what this work means to us and how it impacts us. And that takes a lot of work, and it takes supervision, and it's not easy to do. And so I think one of the ways to do that is to supplement the behavioral analysis work that you're doing with other training. And the three panelists here did that with mental health training. My wife is a speech pathologist in BCBA as well. And that gives a whole nother perspective and way to view the work that she's doing in a dynamic way that I think also allows for some flexibility in thoughts and approaches. So I guess flexibility and humility in the approach, I think, really is important.
Thank you all for such great responses. Just looking at the chat, right? It seems like the responses are resonating so much with those of us who are here. Okay, our next question, and then maybe Dr. Cañon, we could start with you if that's okay. Question is, what mentorship or supervised field work or employment opportunities are you aware of or that you know that are available for clinical behavior analysis?
That's an interesting question. I don't see that there are a lot of opportunities out there. I am not saying that. What I'm trying to say is you need to connect with other people. I would highly encourage you to join the Association for Contextual Behavioral Sciences. You meet there a lot of people, you network with people, get to know, just as I did, I did get to know the work of people that I admire. And that's how you can start, building relationships and seeking opportunities. And if that's not the case, then you need to create opportunities for yourself. But I think even if the opportunities are not something that look like the shiny object, because they are probably not going to look like that, I think that you need to have some or be willing to go back and being a beginner. Of course, depending on your set of skills and your training. So yeah, I just, again, kind of playing the long game. And I can also point to, just to at least feel that I am answering your question. So Dr. Emily Sandos at the Louisiana University, she has a laboratory, and many students from even other schools and practitioners, even having their own private practice already, they join to learn about clinical behavior analysis. So yeah, just to point that out there. Yeah.
Thank you so much. Dr. Young, your thoughts on this question?
Yeah, so I think I got really lucky with my doctoral internship, and just for those who don't know, for psychology, it's a match system. So basically you interview to a bunch of places and you rank them, they rank you, and some computer algorithm tells you where you're going to spend the next year of your life. And so I got really lucky that my computer algorithm sent me to Baltimore to Kennedy Krieger, and I got some really fantastic opportunities to work with really strong behavior analysts who were also psychologists and doing really great work. I thought I knew a lot about behavior analysis until I got there and realized, wow, I know nothing compared to the supervisors there. And it was a great opportunity to learn. There are a few training sites, I think, across the country that also have some of those strengths. I think about like Monroe Myers, Boys Town. What's the place in Atlanta that I'm blanking on? I will think of Marcus. Yes, thank you. And so there are a few places that I think do a really nice job of combining behavior analysis and the clinical work as well.
Awesome, thank you. And Allie?
I truly don't have much to add. I think just to echo what everyone said, join organizations. BCBS is a great one to start with. They have a values-based giving model, so they can really meet all needs. Connect, build that network, talk to people, and don't be afraid to again engage in that reflection. I mean, for me, that's what mentorship and supervision continues to be, even as I mentor and supervise others. That bi-directional learning is so important and fills me up sometimes, I think, more than my students. So it's okay if someone says no, but build those networks.
All right, thank you very much. All right, our next question, I think we'll start with Dr. Young. Are there any specific credentialing bodies for CBA? Is there sort of like BCBAs, right, that we have our board. Is there a way to become certified or licensed within CBA or ACT or, you know, related areas?
So I won't speak to ACT because we have experts on the panel that aren't me. I greatly appreciate ACT, but I'm not an ACT-based clinician. I'm not necessarily that I know of. I think what we're talking about is, in a lot of ways, is that there's additional training that you might need to get in addition to your training as a BCBA, and there are certainly boards and licensures and degrees that you can get in adjacent professions or disciplines that would allow you to get those experiences, and most of those have their own licensing boards. In addition, you know, it depends on which state you're in and whether or not as a behavior analyst you need to get licensed. In Massachusetts there is, and that allows you to do a certain amount of the work, but I don't know of anything, at least in this area of the country, that separates a CBA from ABA and from a licensing standpoint.
All right, thank you. Allie?
I agree. I don't know of anything specifically. I feel like, as we've been talking about, behavior analysis is so broad. CBA is also quite broad, as Gregory said. There's lots of different ways to practice clinical behavior analysis. I myself received some specific mentorship and training throughout the years I've been practicing, and feel comfortable and confident calling myself an ACT clinician, but that doesn't mean I don't still get regular support myself. I also utilize other practices like FAP or functional analytic psychotherapy, and there isn't any one credentialing body to practice that philosophical underpinning. But as Gregory said, it's about making sure that you are receiving and applying for the right credentials to work with in the state that you're at, that you're getting enough support and supervision and training to engage in an area that you are competent in as well. So.
Great, thank you. And Dr. Cañon?
Well, I think that I don't have anything else to add besides what Ali shared and also Dr. Young. I do believe that we right now, where we are, have the opportunity to start practicing CBA, because we not only work with kids with autism, but we do work with their families and even individuals with autism that are highly verbal or engage in more complex repertoires. That's the opportunity to start doing it. Plus, integrating the assumptions that I talked about at the beginning, and the repertoires. If we were to, I'm just thinking, if I were in the shoes of BCBAs who want to shift towards CBA, I will start where I am, looking for mentorship consultation. And then when I shift, then I am not, I guess, so, so behind. In behavior analysis, I think we have everything we need. Yes, those soft skills, a huge emphasis on keeping, I guess, your behavior analysis hat on is huge. That when somebody talks to you, you don't get, I guess, I don't know how to say it, like you don't get hung into, the content of what people are saying, but what are they saying and what is what I'm going to try to do, and why am I choosing this particular, behavior and not other behavior. So again, I think we have the opportunity to do it now while we look for mentorship and consultation. Yeah, that's it.
Great, thank you. So we have a few more questions left. This next one, I think you all might have touched on this in your introductions, but the question reads, what specific populations do you typically work with when using clinical behavior analysis? So I don't know, Ali, if you have anything to add there for yourself.
Sure. Don't kick me off the panel because I work a lot with adults on the spectrum who are highly vocal verbal, who also have a co-occurring mental health diagnosis. So that makes up actually about 70% of the folks that I serve and support. And so I do that in 2 different modalities. One is at our adult learning center, and it is in Illinois, we might call it a day program. It's called other things in other states. I have been really disenchanted, to be frank, with the support that folks get in Illinois. And I wanted to see what I could do about bridging that gap, as I said earlier, between behavioral and mental health, because in 22, services for folks at age 22, they kind of fall off a cliff, and there's very little to support someone, and they're just expected to be an adult after they've been receiving maybe really intensive supports in school for the past 20 years of their life. So I'm gonna get down off my soapbox about that, and that's one of the ways that we support the neurodivergent community is through our day training. And then I also have a telehealth group practice where we provide clinical behavior analytics support to a variety of folks of all ages and genders and backgrounds. And we are really focused in bridging, in providing that holistic support and connecting folks with their community, and bringing in family members or caregivers to make sure that the behavior change that we're teaching and supporting someone through these new skills are able to be maintained and sustained.
Great, thank you. Dr. Cañon, anything to add to this question?
Not really, Dr. Baires, but thank you.
Okay, Dr. Young.
Yeah, so most of my referrals are from local Down syndrome clinics. About 80% of individuals with Down syndrome develop obstructive sleep apnea at some point in their life. And for those of you that don't know, that's when you have collapse or closing of your airway while you're sleeping, and it can cause some really significant long-term health and neurological damage if not treated. Recent study showed a 10-point IQ drop within the first year of untreated sleep apnea. But when you look at typically developing adults, the adherence to CPAP masks are only about like 40 to 60% adherence. And then you try to put a mask, and basically what it does is it forces air through your nose, and it's a mask you have to wear while sleeping. And you try to put that on a child who might have some sensory sensitivities or behavioral inhibition difficulties or increased anxiety at baseline. And it's a really hard thing for individuals to learn how to do. And so that's one of the things I help families learn how to do. And so that would be one subpopulation. And another is those who have chronic health conditions and are getting sick more frequently, or genetic disorders. Often if there's one system in the body that doesn't develop correctly, it's usually not in isolation, and there's usually neurological involvement as well. So supporting individuals with really complex genetic disorders. The other thing I wanted to say is most of my work isn't necessarily with the individuals. Most of my work is with their families and parents and caregivers. And my goal is to teach them everything I know so they don't need me anymore. That's the goal, is to put myself out of business. So yeah.
All right, thank you. I will skip to the last question that we have, and I know the Association for Contextual Behavioral Science was mentioned, but are there any prominent special interest groups or SIGs or professional organizations for clinical behavior analysis? Dr. Cañon, anything to add there?
No, not really. Within the ACBS professional group, there's a SIG, which is called Clinical Behavior Analysis. So
Okay, perfect. Thank you. Dr. Young, anything to add to this question?
Yeah, I think in different areas, either behavioral medicine or behavioral pediatrics, there are special interest groups both in APA and then different ABA agencies. So I think yes, there are in kind of the subgroup that I work in. There's probably enough that it'd be hard for me to kind of list them all.
All right, thank you. And Ali, anything to add to this question?
No, not much more to share. I'd say start at ACBS, good spot.
All right, thank you. Okay, so now we're going to shift to our Q&A portion. So I do see that there are some questions already in the chat. I don't know that we'll be able to get through all of them if more start to come in, but the first one that came in was from Christy, and it reads, does CARF accreditation include clinical behavior analysts? I don't know if anyone in the panel has a response to that.
Do either of you know? Because I don't.
Are we talking about CARF, like the accreditation for rehabilitation in Illinois? I don't know if they have anything specific for behavior analysts. I'm more familiar with them. It's an organizational level of accreditation.
Yeah, so maybe we can come back to that question if kind of more details are provided. But let me go to this slide. Sorry to kind of briefly interrupt our Q&A, but we also have the post-test. So if you completed the pre-test, we also have a post-test. So you can use your phone to scan the QR code to complete this, and I believe we'll put the link in the chat while we do our Q&A portion. Okay, next question I think came from Larry. It reads, do you think there should be certification or licensure to practice clinical behavior analysis? Ali, is it okay if we start with you?
Sure. So, sorry, I'm having a weird technical issue. Awesome, I am off muted. Sorry for a delay. I personally don't. I think it's too broad of a term. We don't require certification or credentialing for many other branches of psychology because it is managed at the state level. So I think it's really important. This is the distinction here, though. I think it's really important to get credentials that are applicable for where you will be serving. So whether that is, again, for me in the state of Illinois, it's a licensed clinical professional counselor. So they manage my license through the Illinois Department of Regulation. And that's what I always tell anybody I'm referring out to. I go to a licensed hairdresser. So you should take your loved one or you yourself to a licensed professional, whatever that might look like. So I think licensing is important. Credentialing is important for various consumer protections, but to license or credential the philosophical underpinnings of clinical behavior analysis, I personally don't think makes sense in terms of advancing our field.
Thank you. Dr. Cañon?
I am kind of hesitant, and I am thinking that if licensure to practice CBA is the only thing that will have people learn what is not currently included in the graduate programs, an emphasis in philosophy, basic clinical skills, and their own work, then yes. But who knows, right? So I guess it's gonna be up to people who have created graduate programs. I don't know what's gonna happen. I don't know what decision is gonna be made. But again, if the only way to have BCBAs have a more integrative approach to clinical issues, then I will vote for yes, not otherwise.
Thank you. Before I call on you, Dr. Young, on you should see a QR code, which will lead to our resources page. So there should be resources to things such as different associations, perhaps that the panelists spoke about today, different articles, maybe some podcasts. So we tried to curate this resource document for you all to have access to, so you can scan it with your phones. And I think Dr. Williams Awodeha put the link in earlier, but maybe if we could put it in, in case people missed it. So Dr. Young, your thoughts on this question?
Yeah, so I think we probably don't need to reinvent the wheel. We have licensures for different disciplines that are credentialed and appropriate for providing certain services. I think where we probably want to develop more is graduate programs that provide dual certifications to allow clinicians to be able to practice in a more flexible way. But I don't think we need to necessarily have more licensures out there. I don't think more governing bodies are the answer.
All right.
Can I add to that just really quick too? Because I think for what both you said is something that I just feel so strongly about is when we don't teach soft skills in our behavior analytic programs, that is also communicating a message that somehow they just develop naturally or they're not important. And I couldn't agree more that this needs to be taught. And so if it has to be through licensure, okay, I'd rather not have more governing bodies, but I do think that it would be amazing to see shift at the graduate level training to really be integrating this and to allow for the flexibility that this could bring about to our field.
Great, thank you for that addition. Okay, so I do see one more question, and it reads, does clinical behavior analysis serve PTSD or childhood trauma populations, as in adults with childhood trauma? So I kind of lost track of my order, but I guess I'll go with Dr. Young first, if that's all right.
That's a good question. And so I kind of feel like I need to go on a soapbox for a moment and kind of think about like what are the evidence-based treatments for trauma. And for a lot of mental health disorders, there's a really strong behavioral component to a lot of them. For anxiety disorders, exposure is a behavioral-based treatment paradigm. For trauma-focused CBT has a really big behavioral component to it, and a really strong evidence base. And likewise, ACT can also be really effective for individuals who are experiencing the impact of trauma. Now, all of what I just described are either CBT or third wave CBT treatment modalities. And so those are not traditionally taught in behavioral analysis programs, but the skill sets that a lot of behavioral analysts get could be really supportive in helping individuals cope with symptoms from PTSD or other mental health illnesses. I think that the foundation that behavioral analysts have in their knowledge can be really crucial and really helpful. I think the field talks about verbal behavior and how covert behaviors can be talked about, and that's one perspective of thinking about and talking about covert behaviors. I think the broader field of cognitive behavioral therapy also has other language and ways to think about covert behaviors and how to understand and change them. I don't know if I fully answered the question. I might have gotten into a slight tangent there.
Thank you for your response either way. Ali, thoughts on that question?
I actually, if you don't mind, because I know, Luisa, you work with, you mentioned trauma specifically in your introduction. I would love to hear your thoughts.
Well, thank you, Ali. So I'm thinking that if clinical behavior analysis, as defined by, I guess, the application of the assumptions and the principles and the methods of like modern functional contextual behavior analysis to clinical relevant problems, PTSD is a clinical relevant problem, right? So then the answer will be yes, from that view. But again, it all relates to also what Dr. Young was saying, and again, everything that we have talked about today. If it doesn't matter if we do ACT or DBT or FAP or any other approach, but at the end of the day, what we do in behavior analysis is generating response variability, and that's the same thing, or flexibility, however people want to call it, right? So if that's at the end what we are going to be doing, then why wouldn't fall within CBA? And that's like the other route to it. So to make it short, the answer is yes.
Great, thank you. And I did see one more question pop in, and then I think this will be the last one, just right at a respective time. So I guess we could start with Ali, and the question reads, how do you approach functional analysis in your specific work?
Oh, I feel like that's a big question, right? Because we study the individual, and in each one is often unique. I think it very much, it depends as we go back to our science and principles, right? And what is our target, and is this meaningful for the individual, right? So I think that's where we start at the beginning. And for me, because so much of my work is ACT-based, that for us starts with values and clarification around that to make sure that we are developing interventions around targets that are meaningful, that are socially valid for the community or the individual that we're supporting. And so that, just from a general perspective, how do I approach functional analysis or an FA specifically? I have to make sure that the target that we've defined is meaningful. Then we go from there.
Thank you. I know this is this question alone could probably be a whole hour discussion, right? Dr. Cañon, your thoughts on this question?
Sure. So how I approach it, as I was talking at the beginning, I think we need to start with with recognizing, what is the unit of analysis. And to me, the unit of analysis is relationships. And that's, relationship to yourself, to the client to yourself, the client to its own culture, to the school people, to the parents, etc., etc. It's like a huge thing, right? So context in that regard. I normally don't, for instance, in ACT, I stay away from the so-called processes. And I have found in my practice, for me, it has worked much better to do an analysis of behaviors that are under appetitive control and under aversive control, while holding not very lightly an interbehavioral point of view, philosophically speaking. And because then that doesn't put me in a position of, well, what is the person really thinking or feeling? I just can't see it because the whole organism is behaving right there in front of me. So when I look at how behavior constricts or gets bigger, then I understand how that is working in relation to my own verbal behavior. But the other thing important in functional analysis is to include yourself as part of the analysis because of that emphasis of the bidirectionality of the relationship. I think that's often bypassed, and we ended up just, putting everything on like environment and the client, and well, this didn't work, or I'm not sure what's happening here. And again, or this doesn't make sense. And again, that brings us back to context more broadly, right? If behavior analysis is a compassionate science, then we make the assumption that all behavior makes sense given its context. So anyway, I think I am, getting far away, and I don't, I just better cut it here. But basically, that's kind of how I work around.
Perfect, thank you. And Dr. Young, anything to share with this question from you?
Yeah, I guess for me, functional analyses, kind of in their traditional sense of kind of empirically demonstrating the function of a behavior, I appreciate them and I think they're great. But in the medical setting, they're often not needed because we know the function of most avoidant behavior to medical care is to escape, because the care they're getting is uncomfortable and painful. And there's often a secondary function of attention seeking, especially when it comes to kids for soothing and co-soothing. And so I don't think we need to do a functional analysis and purposely reinforce problem behavior in order to have an understanding of what's going on for the individual. That being said, being functionally minded in the approach and attempting to have functionally relevant interventions, it still should be a core part of what we're doing.
Great, thank you all so much. Before we say goodbye today, as I mentioned earlier, this is part of a series. We have a 7-part series, and so this is kind of a preview of the different topics that our series is going to cover. So our series is going through until October. So every month from now until October, we're going to have a panel with all of these different topics. And to get more information about who the panelists will be, how to register, all those things, we have our social media accounts for the Behavior Analysis and Therapy program. So we have a Facebook page and Instagram page. And then finally, we do have our page on Southern Illinois University. So thank you so much to all the panelists today. I really enjoyed, I'm sure as everyone else in attendance today, everything you had to share, your experiences, your perspectives. So thank you all so much. I will go back to the resources page if people want to check that out. But I hope everyone has a great weekend, a great Friday. And yeah, hopefully we see some of you at the next panels. So thank you very much.
And we will